Now, the country is on high alert after a man of Asian origin who reportedly arrived from India on Friday was admitted at a private facility in Nairobi after presenting symptoms, some of which are associated with the dreaded coronavirus. Hours into treatment, the 59-year-old man succumbed. Now, according to close sources, officers from the Department of Disease Surveillance have since collected his samples to ascertain the cause of death. Chemutai Goin reports.
Literally a nail-biting moment as test results on the samples collected from a 65-year-old male of Asian origin who died under unclear circumstances are awaited. The gentleman is said to have landed at the JKIA Friday evening, went home and fell ill. Upon admission at the private facility, his condition worsened and he was placed in the intensive care unit. He, however, succumbed. Officials carrying out the tests say the patient initially exhibited symptoms associated with the dreaded coronavirus. However, having travelled from India, which is also grappling with an outbreak of the H1N1 virus and which presents similar symptoms to the COVID-19, they are leaving nothing to chance. The officials are at the same time tracking his history of travel as more countries that have reported local infections are put on the radar. Attempts to get information from highly placed Ministry of Health officials and the said hospital were futile. They both insisted they were not aware of such a case. Since the outbreak of the deadly virus in January this year, Africa and particularly Kenya has been spared the worst.
Let's maintain basic hand and respiratory hygiene and safe food practices.
So far, more than 20 suspected cases in the country have all returned negative results. On Friday, the Health Cabinet Secretary officially unveiled a 120-bed infectious disease isolation unit that will be used to isolate those suspected to have contracted the virus and treat anyone returning positive results. 8 African countries, Algeria, Tunisia, Morocco, Egypt, Senegal, Nigeria, Cameroon, South Africa and Togo have reported incidents, most of which have been linked to foreigners. The virus, which the World Health Organization declared a public health emergency of international dimensions, has claimed 3,522 lives. The number of infections currently stand at 103,882, with 58,464 recoveries. Chemutai Goin,